Regional Medical Center. And this is our operating room. I would like to take the opportunity today to talk to you a little bit about general anesthesia, about the machinery that we use, and about the medications that we administer in order to provide patients with their anesthetics for surgery. So what we're going to do is we're going to walk through how we would go about performing a general anesthetic for a patient coming in for surgery. We start off by having the patient walk into the operating room. We have them lay on our operating room bed. We then go ahead and start placing the appropriate monitors on the patient. This is a pulse oximeter. It is placed on the finger, and it gives us a percentage of oxygen in the patient's bloodstream. We have the EKG monitors that we place on the patient's chest. It is able to show us a heart rate and a heart rhythm, followed by the blood pressure cuff that we apply on the patient's arm. So then we're going to go ahead and we're going to have the patient breathe in some oxygen through a mask. We'll go ahead and put the mask on top of the patient's nose and mouth. Okay. And the reason why we do this is because the patients are breathing in room air, and the room air at this point is full of nitrogen. Okay? We need to get rid of the nitrogen in the patient's lungs, so we have them breathe in fresh 100% oxygen. So, in talking about a general anesthetic, okay, there are 5 goals that we have when we're talking about general anesthesia. Okay? The IV medications that we have, in addition to the gas, all help us attain those goals in order to provide a smooth anesthetic. Okay? So what we're doing when we give a patient a general anesthetic is we are rendering them unconscious. We are inducing them into an unconscious state. Okay? We are maintaining an unconscious state so that surgery can be performed, and then we are emerging the patient from their unconscious state, or what we call waking them up. Okay? So let's start by talking about some of the IV medications that we use in rendering a patient unconscious. Each one of these medications that I am showing you here all have a certain role. They all provide a certain action in the body. But collectively, they help us induce a patient into an unconscious state and help us maintain that state, or general anesthesia. This medication is called Versed. It is a benzodiazepine, and we give it prior to surgery to help patients relax and to help take the edge off so that they don't remember going into the operating room. Fentanyl is a narcotic pain medication. It is a common medication that we use to help relieve pain here in the operating room. The white medication that you see here is called propofol. It is a hypnotic, and we use it to primarily have the patient start falling asleep or render them unconscious. Succinylcholine that you see here and rocuronium are both muscle relaxants. Succinylcholine is a very fast-acting muscle relaxant. Rocuronium or Zemiron is a more longer-lasting muscle relaxant. So what we do is we go ahead and we start giving medications here in the operating room to have the patients fall asleep. Once they're completely asleep, okay, we are then able to give them a muscle relaxant to relax all of the muscles in the body. Once we've done that, we have taken away the patient's ability to breathe on their own. And so what we need to do is then put in a breathing tube to help them breathe. Okay? So I have some examples here of some breathing tubes that we use. This is called a laryngeal mask airway, or LMA. It is placed in the mouth, okay, down, and it sits right above the vocal cords, and it allows the patient to breathe in gas easily in and out through this device. This is called an angiotracheal tube, okay, or breathing tube. It is placed in the mouth with the assistance of a laryngoscope. Okay. The laryngoscope has a light at the end of this blade. Okay. It is inserted into the mouth, and it lights up the back of the throat, so we know where this breathing tube is going. Once the breathing tube has been inserted, we then gently remove the laryngoscope out of the mouth. Okay. We inflate the cuff that sits at the end of this breathing tube. So now, this cuff is inflated and it is sitting inside the patient's trachea, so the breathing tube won't move. Okay. So what I'm going to do is I'm going to attach this breathing tube onto the circuit here to demonstrate, okay, once this breathing tube is in, how we then go ahead and manage the patient's general anesthetic, okay? So, what we do is once the breathing tube is inserted into the mouth, we then place the patient on anesthetic gas and then place them on our ventilator. Because what we've done is we've relaxed the patient and we've taken away their ability to breathe. And so now we need to take over the breathing for them. So what I'm going to do for the purposes of this demonstration is simulate a patient's lung. So this green bag right here represents a patient's lung. And so to recap, what we have is anesthesia gas being sent through the anesthesia machine into this side of our circuit. The gas travels through the breathing tube, which is in the patient's mouth at this point, into the lung. Okay? The bloodstream then picks the anesthesia gas up from the lung and delivers it to the tissues. On return, the bloodstream then picks up the gas from the tissues, brings it back to the lungs. Okay? The gas is then extracted out. It comes out the other side of our breathing circuit, okay? And it continues to travel then into these canisters with the pellets that you see. These canisters are called carbon dioxide absorbents, okay? And what they do is they extract the carbon dioxide from the gas that is coming from the patient, okay? The carbon dioxide is then removed, and the gas then is brought back into the machine and mixed with fresh gas and then sent back through. Okay? So this system is a closed system. Okay? And this is how we manage the patient's general anesthetic. Okay? So during surgery, we are then able to maintain the patient's status. We are constantly looking at the heart rate and the heart rhythm. We're looking at blood pressure monitoring, and we're also able to look at the percentage of anesthesia gas being delivered to the patient and the anesthetic gas that's coming from the patient. Okay. We also can deliver additional pain medications, additional medications to relax the muscles for surgery. Okay. So once we are nearing the end of surgery, what we start doing is we start tapering down the anesthesia gas. Okay. We start checking the patients to make sure that the muscle relaxant has worn off. If we need to give additional pain medications, we can at this point. But we're watching the surgeon to see exactly where he's at and how close he is to being done. Okay? Once we feel that he is just about to be completed, we then go ahead and we shut off the gas completely. We increase the amount of oxygen that is being delivered to the patient because we want the gas off of the lungs. We want it to get out of the body, okay? And we then take them off the ventilator because we want them to start breathing on their own, and we want to be able to assess exactly how strong they're breathing, how much air they're taking in, or how much oxygen they're taking in, okay? So once they're breathing on their own and they start to wake up, okay, surgery is over, we then start assessing exactly how strong they are. So we may have them squeeze our hands, we may ask them to open their eyes, and so once we are comfortable with how strong they are, we then go ahead and we take the breathing tube out. Okay, so here's our breathing tube that was attached to the circuit. We then go ahead and gently take the breathing tube out. Okay, we put the mask back on the patient's nose and mouth. Okay, and then have them just breathe in the oxygen through the mask. Okay? So at this point, we're continuing to assess our patients, making sure that they're comfortable. If they're not, we can go ahead and give them additional pain medications. Okay? And then we then go ahead and transport them to the recovery room. So this is just a general idea of exactly what we do back here. I hope it was informative for you, and I hope that it helped give you an idea of how we maintain a general anesthetic. Thank you.